Well, thanks so much for watching. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and we're talking about our interview with Priscilla Standridge, who was the research director for the Global Women Health Index that Gallup performed. And it was amazing. She works for Gallup. And it was just so cool to hear about how they put this 2-year project together. It was in conjunction with Hologic, which is a medical device company focused on early detection for women. So something of particular interest to them. And then Gallup obviously is known for surveys and doing them amazingly well. And so over this 2-year period of time, they worked together to try to figure out what really mattered to people or mattered for the health of women. And so they gauged preventive care, emotional health, opinions of health and safety, basic needs, and then I think individual health was the 5th one. And they also said that there were 3 areas that really impacted a woman's results, which were her education level or how much education she had, the safety that she felt both within her own house and her walking around in her neighborhood at night, and then age at first pregnancy, with pregnancies starting under 18, leading to significantly worse health outcomes overall and life expectancy. And so it was just so amazing to hear how Gallup went about figuring out what really made a difference, because you have to factor in all of the cultural norms and also what people know about. We talked about prenatal care. What do people know is good prenatal care if they're living in a country where they may have no access to care? And hearing her talk about the whole process, the findings that they had, the fact that the United States ranked number 20 and the territory of Taiwan was number 1, Peru was last, and just hearing the different nuances that each of these areas really revealed and what they're hoping to accomplish was amazing. And I found it to be a fascinating interview. Apoorv, what did you think?
I think I agree with you, Stephanie. It was indeed really fascinating. It's, you need data for everything, but then it's not so easy to get the data, right? That's a common theme that we hear everywhere, especially when you're trying to do it across the globe. Every single country, you're trying to figure out how do we figure out a way to gauge the health of women? And that is significant undertakings to make sure you're measuring the right things. They're simple enough and that they correlate with outcomes. So it was interesting to hear Priscilla talk about how they looked at the data that had come back and how it tracks against the outcomes. But at the same time, it's actually more consistent because they can do a survey and they can do it reliably. They can get across that survey throughout all the other countries. And when you try to use data itself to compare countries, there may be big pockets of data that are actually missing. So I found that really fascinating, is that this survey methodology can become a very powerful way to complement some of the other outcomes-based measures that people might be looking for. That was really interesting. Definitely fascinating what you already mentioned, that they have ultimately found that it's really simple things like education and safety and age at the time of first childbirth that really determine the health of women. So that's probably something many of us know, but maybe not something that we all underscore and think about. With the right social measures and the right public health measures, there's a lot that can be done for improving women's health around the world. Love the way that they're actually thinking about undertaking this, maybe making some correlations with another index that they run, the World Happiness Index, trying to understand where health and happiness overlap and where they don't. So I found that fascinating as well. And in general, the time scale is something that Priscilla reminded us when you asked her, so what are you hoping to achieve in 5 years? And she said, well, a lot of this is deep development work. They think generationally. There's things that Gallup has been measuring for 60 plus, 80 plus years. And it will take time before they start to see an impact. But unless you have the data, you can't measure it, you can't improve it. So this is the beginning of their journey. And I'm hoping that as we continue to track it, we'll see that people start to pay attention to how they're ranking on the index and then want to do something to fix it.
Absolutely. It's an impressive undertaking, that's for sure. So be sure to stay tuned for the full interview with Priscilla on Thursday, and we'll talk to you soon. Bye-bye.